When it comes to intimate health decisions, few topics feel more personal or more confusing than circumcision. Maybe you've been living with discomfort. Maybe you've heard conflicting stories. Or maybe you're simply wondering if this procedure could change your life for better or worse. Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon, and if you ever face questions or concerns about your urological health, stay with us. We're here to help you understand your body with clarity and comfort. Today, we're going to walk through everything you need to know about adult circumcision, not with judgment, not with pressure, but with honest medical insight. We'll explore why some men choose this path, what the science actually shows, and what you can realistically expect if you decide it's right for you. If you're new here, welcome. This channel is built on one principle. Your health matters, and you deserve to understand it without shame or confusion. So please, subscribe and share this with anyone who might benefit from clear, compassionate guidance. Let's start with the basics. What exactly is circumcision, and why do adults consider it? Circumcision involves removing the foreskin, the fold of tissue that naturally covers the head of the penis. For infants, this is often a cultural or religious choice. But when adults pursue circumcision, the reasons are usually medical, personal, or both. Here's what I want you to understand right away. There's no universal right answer here. Some men live their entire lives comfortably with an intact foreskin. Others find that their foreskin causes recurring problems, pain, infections, or difficulty with intimacy, and removal brings relief. This is not about being better or worse. It's about what works for your body and your life. Why men consider adult circumcision. In my practice, I see 3 primary medical reasons. First, skin conditions that won't resolve otherwise. Conditions like lichen sclerosis can cause the foreskin to scar, tighten, and become painful. When the tissue changes, turning white, hardening, or cracking, it can make urination uncomfortable and erections painful. For some men, topical treatments help. For others, circumcision becomes the path to relief. Second, chronic inflammation or recurrent infections. This is called balanitis, inflammation of the foreskin and the head of the penis. It often stems from difficulty retracting the foreskin fully or from inadequate cleaning beneath it. When infections happen repeatedly, scar tissue can form, making the problem progressively worse. If hygiene measures and medication don't solve it, circumcision may be the most practical solution. Third, paraphimosis, a true emergency. This happens when the foreskin is pulled back and gets stuck in that retracted position. The trapped skin acts like a tight ring, cutting off blood flow to the tip of the penis. The head swells dramatically, and the longer it's left untreated, the worse the damage becomes. If this ever happens to you, go to the emergency room immediately. We can usually reduce it manually, but sometimes emergency circumcision is necessary to prevent permanent harm. Beyond these medical reasons, some men pursue circumcision for personal or preventive reasons, aesthetic preferences, cultural expectations, or concerns about infection risk, and that's valid too. Your body, your choice. Let's talk about what leads to these problems and what keeps people confused. Why foreskin issues develop. The foreskin is designed to protect the sensitive head of the penis, but it requires care. If you can't retract it fully, or if you don't clean beneath it regularly, moisture and bacteria can accumulate. Over time, this leads to inflammation, infection, and scarring. Some men are born with a naturally tight foreskin, a condition called phimosis. For others, it develops after repeated infections or injuries. Either way, when the foreskin becomes too tight, it creates a cycle. Retraction becomes painful, so cleaning becomes difficult, which leads to more infection, which causes more scarring. The myths that won't die now. Let's address some persistent misconceptions, because I hear these constantly. Myth number 1, circumcision ruins sexual pleasure. This is the biggest fear I encounter, and it's understandable. The foreskin does contain nerve endings. But here's what the research actually shows. High-quality studies comparing circumcised and uncircumcised men have found no significant difference in sexual satisfaction, orgasm quality, or erectile function. I'll explain the science behind this shortly, but for now, know this. Most men who undergo adult circumcision report no negative impact on their sex lives, and many report improvement, especially if they were dealing with pain or embarrassment before. Myth number 2, you'll lose all sensitivity. Right after circumcision, yes, the newly exposed head of the penis will feel hypersensitive, even uncomfortable against clothing. This is temporary. Over a few weeks to months, your body adjusts. The most pleasurable nerve endings, called genital corpuscles, are actually located in the ridge of the head, not in the foreskin itself. Those remain intact. Myth number 3, it's just cosmetic. There's no real benefit. For some men, it is cosmetic, and that's okay. But for others, circumcision eliminates chronic pain, prevents recurrent infections, and dramatically reduces the risk of penile cancer and certain sexually transmitted infections, including a 60% reduction in HIV transmission risk. What about regret? Here's the hard truth. Some men do regret circumcision. It's irreversible, and if the outcome doesn't match expectations, whether in appearance, sensation, or function, that disappointment is real. This is why I always tell my patients, be absolutely certain. Don't rush this decision. Consider your reasons carefully, and if you have any doubts, take more time. If you're considering circumcision, here's what the process looks like and what to expect. The consultation. When you come to see a urologist, we'll start with a conversation. What symptoms are you experiencing? How long have they been going on? Have you tried other treatments? We'll examine the foreskin, check for scarring or infection, and discuss whether circumcision is truly the best option. Sometimes less invasive treatments, like steroid creams or stretching exercises, can resolve the problem. Other times, circumcision is the clear solution. If you have aesthetic preferences, how much skin to remove, where the incision should be, speak up. Most urologists aim for what we call a just right approach, enough removal to eliminate problems, but not so much that it causes discomfort during erections. The procedure itself. Adult circumcision is typically done as an outpatient procedure under local anesthesia. Here's how it works. 1. Preparation. The area is thoroughly cleaned and draped. 2. Numbing. You'll feel 1 or 2 needle pricks as the anesthetic is injected. These block the nerves to the penis. Some men barely notice. Others even fall asleep during the procedure because the numbness is so complete. 3. Removal. The surgeon carefully removes the foreskin and closes the incision with dissolvable stitches. The entire process takes about 30 minutes. 4. Dressing. You'll leave with a protective bandage, which stays on for a day or 2. Recovery. What to really expect. Here's what no one warns you about. When you first remove that dressing, your penis will look alarming. Swollen, bruised, unrecognizable. This is normal. Over the next week or 2, the swelling will subside. You can use ice packs, wrapped in a towel, to help. Pain is usually manageable with over-the-counter medication like ibuprofen or acetaminophen. Important guidelines. Once the dressing is off, you can shower. Let soapy water run gently over the area. Avoid baths for 2 to 4 weeks. Some doctors recommend applying a thin layer of petroleum jelly or antibiotic ointment to prevent the incision from sticking to your clothing. No sexual activity or masturbation for 4 to 6 weeks. I know that sounds like forever, but healing properly is critical. If you get erections during this time, don't panic. They won't damage the healing tissue. Does circumcision change your sex life? Let's revisit this question with real data. The best research we have comes from large, well-designed studies, including randomized controlled trials in Kenya and Uganda involving thousands of adult men. These studies tracked sexual function, sensation, pleasure, and satisfaction before and after circumcision. The findings? No significant difference. Men who were circumcised reported the same levels of erectile function, orgasm quality, and overall sexual satisfaction as those who weren't. Here's why this makes sense anatomically. The most sensitive, pleasure-generating nerve endings are located in the head of the penis, particularly along the ridge. These remain completely intact after circumcision. The foreskin itself contains nerve endings that respond to touch and pressure, just like skin anywhere else on your body. But they're not uniquely responsible for erotic sensation. That said, individual experiences vary. Some men report heightened confidence and comfort after circumcision, especially if they were dealing with pain or self-consciousness before. A small number report changes in sensation, usually temporary, as their body adjusts. So where does this leave you? Circumcision is a personal decision, and it's not one to take lightly. If you're experiencing medical problems, chronic infections, painful scarring, recurrent inflammation, it may offer real relief. If you're considering it for preventive or aesthetic reasons, that's valid too, but be sure you're doing it for yourself, not because of pressure or shame. Here's what I want you to take away. There's no perfect answer. What matters is what's right for your body and your life. High-quality evidence shows that circumcision, when performed well, does not harm sexual function. Recovery requires patience. Give yourself time to heal, both physically and emotionally. Regret is possible. That's why certainty and choosing a skilled, experienced surgeon is so important. If you're still unsure, talk to a urologist, ask questions, express your concerns. A good doctor won't push you toward surgery. They'll help you make the decision that's truly best for you. And if you've already undergone circumcision and you're struggling, whether with physical symptoms or emotional adjustment, please reach out to your doctor. You're not alone, and there are ways to address what you're going through. Thank you for trusting me with this conversation. If you found this helpful, please share it with someone who might benefit. And remember, taking care of your health, especially the parts that feel vulnerable or confusing, is one of the bravest things you can do. Stay connected, stay informed, and most of all, take care of yourself because you're worth it.